Herzlich willkommen zum Online-Kongress Glückliche Geburt. Ich bin heute wieder mal in einem persönlichen Gespräch mit Ranjith. Er ist traditioneller Osteopath und wird uns heute einiges dazu erklären, wie uns das helfen kann während der Schwangerschaft und auch für die Neugeborenen schon. Welcome Ranjith. Thank you for your time.
No, thank you for having me.
I would like to ask you if you could, can introduce yourself a little bit. Yeah.
Sure. I'm Ranjith. I grew up in Geneva in Switzerland. I'm an extreme sportsman. I do a lot of sports. I'm an athlete. And one of the reasons why I got into becoming an osteopath is because of a lot of long-standing injuries I had, or I've had, and had to manage. And nothing was getting down to the bottom of where my cause of the pains were. And finally met my neighbor who was a traditional osteopath, and within 20 minutes putting her hands on my knees, there was no pain, and she said, just strengthen up your legs, which is actually the reverse of what the doctor said to me.
Okay.
The doctor said no more training, no more exercise, do not do any squats or lunges, and she was like, no, strengthen, you'll be fine.
Okay, wow.
So you see, very contradictory information. And basically from that I pushed myself to become even more of a better athlete. I used to do a lot of competitions, and osteopathy is what really got me back onto my feet. So for me, I feel like it's a message I need to give out there to the world. It's a gift to be able to help people, to be able to give them that power to empower themselves again. And for me, that's the very important thing, because I was taken my power away from the doctors telling me, no, I can't do something. Thank God I'm strong in my mind and my soul that I went, no, I'm going to try. And that's what happened. And so, that's what got me really into it. And, I started off with sports massage. I'm also a personal trainer. So I use all that sort of information. So sports training, rehabilitation. And I always had a missing link. And osteopathy for me was the complete medicine of the human body, and that's why I wanted to learn traditional osteopathy.
Great. Could you explain us how it's working in general?
Osteopaths, we look at the body as a whole. So when I treat a patient, I don't treat the illness, I don't treat the symptoms, we treat everything. So depending if the person's stressed, if the person's in a bad posture for many years, has had an emotional trauma, lost someone in the family or something like this, all these will play onto our systems in our body and decrease its functionality, which means we need to, as osteopaths, try and increase that so it has better functionality, mobility, blood flow, so that it's in its best ability to auto-heal, to purge the body, to function to its best of its ability. And that's what we do as osteopaths. So we look at not only symptoms and not only causes, we look at the whole. And that's very important, because other professions are looking at specificities and we're looking at as a whole.
Okay, cool. And for me, it was totally new when I was pregnant. I had my first treatment and I was a little bit like, okay, what is she doing now? Because it was just like a little, how do you say?
Very soft palpation.
Exactly.
Yeah.
So how is this working? Yeah.
So in osteopathy, what we learn is palpation. So we have nearly a whole year of just learning how to palpate certain parts of the body. So by just putting our hands on the cranium, we can palpate the bones, the liquids, the fluctuation of cerebral spinal fluid around the brain. We're looking at the different tents inside. So over time, you develop a much better sensation in your hands. It takes time to really learn, because you've got to learn how to dialogue with our tissues. And you have got to think we are an organism. We are not working on batteries, switch on, off. We are always on. So this vibrational force has to be free to do expansion, retraction, to be able to pump the liquids, the blood flow, everything around our body for it to function to its best of its ability. So again, what we do as osteopaths, through the gentle palpations, osteoarticulations, sometimes a little bit more more harder palpations, but all depends what are we working on and what is the treatment plan. What we're doing is we're freeing up the body. We are a fulcrum for the body to rebalance itself, to find homeostasis.
Okay, wow.
Yeah.
The Congress is about happy birth, let's say, and that the women have a very good preparation for the birth of their baby. What would you say, why is osteopathy important? That's in the end, to have a good birth experience.
So from my experience, having worked with many women in pregnancy, pre, post, and during the birth, we basically help as osteopaths to create more space into the body. And also what happens as the body's shifting through its trimesters, your organs are getting pushed under the diaphragm as the baby is growing. And what happens is, most women will tell me this is, I had to go to the bathroom more often than other. So what happens is if the baby's sitting on your bladder and you try and sit down, that minute, every time you want to go to the bathroom. So if we as osteopaths, we can create more space, we can help free up compressed organs or the uterus, and just be able to give the ligaments and the body space for it to expand, and it's naturally with no sort of pain and or discomforts. And this is what I've found with every woman I've treated so far. They, would have been a sciatica, would have been, I can't lift or I can't bend over. But after treatment, they are doing things that they never thought they could be doing. I mean, I'll give you a perfect example. My wife, who just gave birth a couple of weeks after you, Yasmin, she was 2 weeks back in the gym after giving birth. She's eating really, really well, so non-anti-inflammatory foods, which are very important, especially after giving birth, because your body goes through a trauma. So the more you can give body the best fuel to heal, then you are going to allow your body to heal a lot faster. So that, plus the training, plus she was getting treatments with me, plus the baby gets treatments, because what's beautiful is when you treat a baby, the mother gets treated indirectly. Okay, and it's very funny because sometimes I will approach the baby and I'll touch the baby and I'm like, no, it's not the baby, it's the mum.
Okay.
Then I have to treat the mum. Then I put the baby on the mum, and then we treat baby together, and it creates a synchronicity of like energetic force. You can feel it. You'll feel it. It's the heat that energy generates from it, and it's that balance. You want to get back to that baby between them, because the baby has just come out of a very protected womb, in no gravity. To all of a sudden, gravity, air, light, sounds.
Yeah.
So now it's having to get used to all that. So at any time you can give it comfort or free it up, or just give it that assurance of safety, because one thing people forget is that a baby, when the minute is born, it is helpless. It depends on you for food, for everything. So the biggest fear a baby has is abandonment. Okay, and the problem is today in our everyday lives is we're too busy. We're far so busy. Mums, dads, we are too busy, and we do not have the time to spend with this, or we don't make the time to spend with this beautiful, perfect human being. And this is where we need to shift that understanding, where yes, you need to be good as a person yourself. You need to be healthy to be able to be healthy with your child, which is important. But look, I bring my child to the gym and train with me. It's not the same training, but it's a training.
Yeah.
I'm doing something. I'm pumping my blood around my body. I'm getting over 140 beats a minute. And that is moving the lymphatic system. And this is what is very important for a woman, especially during the pregnancy, to keep moving.
Yeah.
Okay, so my wife, throughout the whole pregnancy, her first trimester, she was bedridden. Couldn't move, vomiting, everything you can imagine, for 3 months.
Okay.
After that 3 months, the switch happened. Okay?
The best period,
The best period. She was training, she was walking the dog, she was, doing so much more than I ever thought. I was the one worrying about her being overprotective. So she's a strong woman. She's trained with me we've been together for 12 years, so she's been training with me since we've met. we met in the gym.
Okay.
So that's how the progression. But when she never was in her fitness, so now she's really into it. I can't stop her anymore. It's literally, if I want cuddles in the morning, it's like, no, I'm going to the gym. I'm like, okay, but in a nice way. I love it because I see that drive that she has, and this is what I want to encourage women: is that it's not because you're pregnant that you can start eating rubbish. Because that artificial sugar or that refined sugar that you're putting in your body, saying, oh, it's okay, it's chocolate and this and that, you're not helping your baby at all. And actually, you could create yourself an diabetes through pregnancy. So I don't want to. I keep going.
What would you say when you have a pregnant woman? How do you start to treat her? Or it's just you have to start to talk to her, of course, and then. How is this working?
So like every treatment, you take a medical write-up. So I take an anamnese, where it was about 20, 30 minutes, where I'm asking her all sorts of different questions, any history of any sort of accidents, pains, injuries, surgeries, traumas in her life. And then after we go follow that through some tests that I do on the spine, looking at where she's translating between left and right, is she shifting her body properly, if she's not side-bended, or just to make sure that everything's free. Then after that, we treat, obviously, different trimesters differently. But usually, absolutely everything is absolutely fine that you can do on a pregnant lady. When you get to second and third trimester, lying on the back becomes a bit tricky. So we lie usually our patients on the side, or I get them up on pillows and have all sorts of different ways. Usually in third trimester, we do a lot of movement work, which is what we call unwinding of the tissues. So it's really just in creating more space for her to be able to, for the mother to be able to sleep better, for the baby to have a bit more space. In case the baby's stuck and breech, we can help rotate the babies. All sorts of things like this. I mean, I'll give you also another little example if you would like. During the birth of my wife, at one point, she said to us, and I don't know if I can say this on camera, but I'm going to say it anyway. She was like, "Oh my God, I feel like the baby's coming out backside my anus." That's what she said. So, if you understand the birthing canal of the pelvis of a woman, the birthing canal and the rectum has the same planes. Okay, which means as the baby's coming through and doing a left spiral rotation to come out, it can get stuck, and it can feel like, because it has to go up and round like that. Now, if you're lying back and giving birth on your back, your coccyx and sacrum is up like this.
It's not really helpful,
and
right?
your head is hitting the baby. And most babies who are born like this, you can see there's a scratch on the back of their head.
I also didn't know that. I mean, of course, I was prepared because I had my best team ever,
Sure.
But in the beginning, you always see the movies and stuff like that when the women are laying in their bed. So this was actually also my idea. Not to make a squat or whatever.
But it's because that's what we've been shown. And the only reason they do that lying down is because it's like a conveyor belt. If you get one, boom, move them out, stitch them up, move out. Next, move in, move out. Put them in the, and this is just, because if we had to give time, there's two reasons. If we had to give time to every woman to go through their birthing process, the hospitals would be having a backlog of waiting, a waiting list of people waiting. And there's some people who can't wait, some people can. I'm not saying it's correct. I'm not saying it's wrong. I'm just saying there should be somewhere in the middle where we need an understanding. And I think that understanding is people like us being able to give this information to people so they have the conscious mind to be able to make this conscious decision, or have partners or a team that can make those decisions for them. So I think that's answered the question.
I was also surprised when I had my treatment, because she was asking me, okay, what's your problem? I don't have a problem. Maybe sometimes a little bit the back hurts. I mean, this is normal. But then she also was like, okay, checking me and stuff like that. And then it was, okay, you are a little bit like crampy. No, how do you say in English? Like with
tense.
the jaw, tense. And I didn't realize this. And she said, okay, I will treat this part because it's important, as it is connected to my vagina, And actually, I didn't know that so many things are connected together, and this was very important for the birth, because I was always like, okay, relax your jaw,
Yeah.
And then I was also relaxed here, in this area.
Of course.
And this was incredible,
Did anyone tell you about massaging the vaginal perineal walls? Yeah.
Yeah.
Or most
My
people.
doula.
Yeah, but again, your doula. It wasn't the doctors.
Yeah, exactly.
Right?
Yeah, that's true, actually.
And this is what my point is. This is again what doctors should be saying. Saying you should be going in there and massaging. Yeah, and it's not pleasurable. It's not like you're going in there and it's for fun. It's actually not. My wife used to. I can use this as my wife. Sorry, bless you. But she used to say to me, "It's not fun."
Yeah, I know.
And it's you got to go in and stretch and move. Open up, and so that you're gonna decrease the risk of tearing. And plus you're creating elasticity, blood flow to this area, and if you've got that, you've got health.
I also realized after a while that in the beginning it was really like, I don't enjoy it, but then it was much more comfortable.
Of course, the first 3-4 times, like, that's not comfortable, and then you just get on with it.
Exactly.
It's just like, right, it's something I have to do, and then you do it. And then look, for Claire, she was standing up, practically, leaning over, and the whole baby came out. So in one go. And to come back to the story that I wanted to come back in the first place, where my wife was saying it feels like it's coming out my anus.
Yeah.
I said to her, don't worry, it's not. It has to follow that same canal. But she was getting to a point, it's tired, 14 hours or 12 hours. And I said to her, I had a look down and I could see the bulge of the baby's head coming right between the ischial tuberosity and the anus. And I'm like, okay, this is where most women would rip. Okay, so we did a technique that we learned in osteopathy where you just push the head a little bit by just grabbing on the ischial and just moving the head. And 2 pushes later, the whole baby was out.
Wow.
Okay?
Yeah.
And that, if I probably wouldn't have done that, she would have ripped pretty badly. I'm pretty sure about that.
Okay.
Because she also went into a bit of a panic mode in that last 5 minutes, and we were trying to calm her down, and she did absolutely amazing. She did calm down. She listened. She focused with the doula, with me, and literally, even the midwife was there for the last push. Okay, push. So it's really, in all those stages, as a man speaking to other men, all I could say is be there with your woman. Whenever you have a moment, get out, just to recap yourself, where you are. Go back in, support her, be there, shout, do the warrior crowds with her, support her back, and just listen to what she needs to do. Try and, do the minimal, but whatever, just even sometimes caressing won't be enough or too much, So just be there as a support. If it gets a bit heated, walk out, come back in, just let the doula or someone be there with you. I think it's extremely important to have another woman there with you.
Yeah.
Usually not your mum, but have a doula or someone there. Just is so much. It's like having a sister there next to you, like a warrior sister to support you through that. And I think, having seen it with my own wife and hundreds of different women I've worked with, it's phenomenal to have that support. So
for us was the same, because actually the doula was there. To talk to the other midwife and to the doctors what I want and what I not want. She was really like, okay, she doesn't want that you give me PDR, only if I ask for it, stuff like that. But she was also supportive for my husband, actually, because, it was the first birth, and he was also very excited and nervous, so it was so helpful for us, So I really would recommend, okay, have a look. If you want to have your partner, maybe also a doula, check it out, what is possible in the hospitals in Germany or wherever you are or wherever you want to have the baby, and then find your best birth team. And what is great to hear that you also can treat the newborns, the little tiny babies.
So again, I'll give you a little example. My baby was born a little bit cone head because on the last 10-15 minutes, let's say, of the birthing, she got a little bit stuck, where my wife was saying it was stuck in the end. So obviously that pressure, the pushing, cones ahead. It's also a natural process. This is why most babies, the cranial bones are not suited yet, and it takes about a year for them to suit.
They look like a little alien in the beginning,
so right? Literally it was an alien like this. And I know straight away that we want to make sure that the baby latches, so my hands were straight on my little girl. And within an hour or two, her head was absolutely perfect. So, and you could see her really calm, eating, no crying, just really, really relax. And that's what you want. A baby that is relaxed at birth. You know, you want the first cry, obviously, make sure it's breathing, everything's flowing. And then after that, you put her on your belly of the mum and just hold her there. Don't wash her. Keep her like that for a while. You know, we didn't wash her until probably the next 2 days. Yeah, 2-3 days. Yeah. So really, just that's very important, and just a very, very important key. I always say to all my mums is follow your instinct. Whatever your instinct says, don't listen to your brain. Listen to your instinct. Whatever you may feel, listen to that. Even if you don't remember, just write it down. Because your mind's going to play your tricks. Yeah. Don't worry about that. You're fine. No, listen to your instincts.
It's amazing how the instinct is working. I also didn't know in the beginning, but you have the feeling, and the feeling is right.
It's always right. Yeah. It's never wrong. The instinct. You know what is wrong all the time?
Yeah.
Because we go left, right, positive, negative. This is just going, this is not right, or this is good. Yeah. Period.
Also, Ranjith helped me with my little baby girl because I also had problems in the beginning with breastfeeding, and it hurt a lot and stuff like that because she didn't open the mouth properly. So this was also so great. Yeah.
So to explain what we did with your daughter is that she had her occipital condyle, which was jammed, which normally can happen during the birth, through the birth. It's a very common thing. Now, what the doctors will probably say is, try and talk to the mum. You're not feeling well. Then they give you a breastfeeding specialist, and they try and show you how to latch on. It can be quite painful, and if it's not latching on, and you can see the tongue movement straight away, and it's not even 10-20 minute treatment with my 2 little fingers, and you're just moving the occiput back, and you'll see, because what it does is compressing. We call the lacrimal nerve, which is the nerve that helps you latch. The tongue movement does this, going up and down. And if this occiput is blocked, the tongue movement can't happen. Yeah. Wow. And you know the little the little dots around the nipple? Yeah. They are the ones that, by the stimulation of the baby latching on, will stimulate the oxytocin and get the milk to be released. So that is a very important process, which I find is not explained enough to mothers. So,
that's true, actually. Yeah.
So if they could understand that more, straight away they go, right, osteopath, I need
Exactly.
And it'd be incredible, the difference.
So osteopathy is not only for pregnancy women; it's also for the whole process. Let's say, as you said in the beginning, for the post part. And
pre, post, and during, if ever they need assistance. I've assisted quite a few births in Ibiza, some in London, some.
Actually, I didn't know that this is working. Let's say, or this is allowed, or I don't know, but I didn't know that it's
allowed. There's nothing
which is not allowed. Yeah, I know. You are a friend or whatever.
That's it. That's all. I'm not. I don't go in there as being a professional because obviously you have to deal with the Western sort of ways, and they always look at you like, what do you know? And I'm just there. I'm always as a support.
Yes,
just
exactly.
a support.
It's a support.
And there's one thing I am very, very, very clear about is we are absolutely an amazing profession in osteopathy where we want to work with different people. So, I work very closely with chiropractors, with physiotherapists, with different doctors, obviously of choice, who I think are on the same wavelength, who are open to different medicines out there, and who want to work like that. So in London, I used to work with a lot of different trauma specialists from accidents. So I used to work with them, and they used to come and see me post-surgery. So that was really good for blood flow, for increasing mobility, motility. And this is very important constantly, because what we have to remember is most of us have sort of lesions accumulated in our body, lesions being injuries or tensions. And if we don't, over time, deal with it, over time, these lesions become hard, solid, like fibrotic tissue. So all of a sudden, the lack of blood flow. When there's a lack of blood flow to certain tissues, it becomes cell death. And that's where the problem starts lying. If you're constantly sat in compression, you're compressing your liver, you're compressing your stomach, then your stomach is your liver and your stomach have to build more tissue to support it. Then it decreases its function because it has less mobility. So all these things, and having watched and done a lot of autopsies or dissections, So obese people, different stressed people, and you could see the different tensions because of their gaits, their bad postures. So yeah, osteopathy for me was complete in that way. So I could go on.
No, it's really amazing. I really enjoy listening to you. Is there one last sentence you want to say?
In osteopathy, for basically for anyone who's wanting to fall pregnant or just about to give birth, first thing is go in very relaxed. Relax your mind. Try and create that environment. Even if you're in a hard relationship or parents are not there, create this bubble, because you are going to become a parent yourself, and you need to learn your boundaries. 2, definitely go and see a traditional osteopath. There's not many of us out there who are traditional osteopaths. Okay. There's a lot of different osteopathic schools who do different things. For me, the reason why I went to traditional osteopathy, for me, was the complete medicine. And that's, for me, very important. If you don't see an osteopath, you can also see a craniosacral therapist who will work on the liquids, will help with giving space a little bit, at least in the whole central chain. But definitely, osteopaths will give you the benefit of being much more comfortable throughout your pregnancy. And also what it does on a cellular level with your mind, it relaxes you. Yeah. And every person I've treated in every trimester, especially when they get to the 3rd trimester, I try and treat them at least once a week. Mm-hmm. What happens is that they get more tired, they can't sleep properly, they're restless and all this. So what you do by the treatments, by me giving them treatments, they sleep amazing for a week, and then of course it comes back, and because the baby's growing, so then we do another week, and then usually at that time, that's when the baby's due.
Great.
So, yeah.
Great. Thanks a lot.
My pleasure.
You are living here in Ibiza, so
I am, yeah.
For treatments, it's for personal treatment, it's a little bit difficult if the people wants to have one. But I know that they can contact you online if they maybe need some help or advices or whatever.
Absolutely, you can contact me online. You can see me. I've got a new page that I've created called the Move Method. Move Method is mindfulness, osteopathy, vitality, and exercise. So it's combining all of that I've learned over the years, and giving people not just some treatment, but the complete understanding of, look, I'll treat you, but then you have to do the homework, the exercises of stretching, and start creating this lifestyle that will give you longevity.
Great. Yeah. We will have all the contacts here on the side.
Yeah.
Thanks a lot for your time.
No, thank you very much.
For all the information.
Absolutely. Any more, let me know.
Okay, great. Ich hoffe, es hat euch gefallen. Wie gesagt, die Informationen über Ranjith, wie ihr ihn kontaktieren könnt und so weiter, findet ihr auf der Kongressseite. Und ja, sucht euch einen Osteopathen. Kann ich echt nur empfehlen. Und ansonsten Dankeschön fürs Zuschauen. Bis zum nächsten Mal. Tschüss.
Tschüss.